It's my great pleasure to introduce Dr. Hannah Milch for mentoring grant rounds. Dr. Milch is a radiologist specializing in breast imaging, assistant professor at UCLA. She is a Yale alum, having received her BA in history here from Yale and her medical degree from Boston University. She did her diagnostic radiology residency at Montefiore, where I came to know Hannah, and we worked together on our areas of mutual interest. She did her fellowship at Sloan Kettering in breast imaging, and now she's a breast imager par excellence at UCLA, where she is also really an emerging grant-funded researcher and scientist, as well as a mentoring guru. She's active in all facets of education and clinical work in breast imaging. She's very interested in AI in breast imaging, and also in the use of academic RVUs as a way of encouraging scholarly activity and mentorship activity, kind of counting the things that count, which is an important facet. At Yale, we always struggle with how to count some of the intangible things that we do, and it's not just at Yale, it's everywhere. She completed the mentorship program at the UCLA Department of Radiology, and now she is the co-director of Teach the Mentor program at UCLA, which she'll be describing to us. And we're planning, Renee Butler and I are planning to initiate a similar course for the radiology faculty in the fall as well. She also has the CRAF Award, which is a big grant from the AUR, now the AAR, and also a very large grant utilizing spheres of influence to increase cancer screening, which is really like an important area of interest, common interest for lung and breast cancer and other imaging-based screening. And she has more than 25 publications in high-impact peer-reviewed journals. She's chapters, presentations, abstracts, talks, and it's my pleasure to have Hannah here. She flew all the way across the country just to present to us this afternoon. I'm looking forward to hearing your talk.
Thank you very much. Okay, thank you guys so much for having me. Very excited to be here. So as Linda said, I'm a breast radiologist at UCLA, and it's great to be back here in New Haven, my alma mater, especially in February. So today I'll be talking about mentorship in radiology. Okay, so first we're going to review some evidence behind mentorship practices. We'll take a look at the Teach the Mentor course that I co-lead at UCLA. And this portion of the talk will include some interactive cases. Thank you, Eve, if she's still here, for helping me set that up. And so I'm going to take you through some of the difficult mentorship case examples that we use during our course. And then finally, I'll discuss some ideas for the future of mentorship at UCLA and beyond. So evidence shows that mentorship leads to successful careers in academic health sciences, stronger clinical program development, increased authorship, and federal funding. Mentorship takes a village. It's not about one relationship. It's about a network of relationships that really allows mentees, in this case, junior radiology faculty, but in any facet of life, excel. So just like raising kids, it takes a village to mentor successfully. And importantly, mentorship benefits everyone. Research shows that mentorship programs help both the mentee and the mentor get promotions and salary bumps, and also can increase job satisfaction and retention. This is really important in radiology, where practices are trying very hard to retain and recruit top talent. We also know that not everyone has the same access to great mentorship. It's been shown to be lower for women and those of color, which in turn can perpetuate existing disparities in academic medicine. So by increasing the pool of high-quality mentors, this may help address this inequity. So normally when you see reference to a mentorship program, most of the time it's referring to a structured initiative that usually pairs a mentee with a mentor. So you kind of get that established bond. And there's been lots of studies about mentorship programs and their benefits to all involved. However, this model assumes that the mentors know how to be good mentors. And so at UCLA, we have this Teach the Mentor program that provides practical skills to help faculty learn to become better mentors. So this course occurs once per year at the start of the calendar year, and each session covers a different theme and always includes discussion of provocative mentorship dilemmas that promote reflection of one's mentoring philosophy and tactics. We carefully select about a dozen faculty each year and try to create a group that has a lot of variety in terms of academic rank and subspecialty, because this group dynamic is critical to the success of the program. The most of the learning from the course comes from hearing perspectives from the different minds in the room. So we like to have senior mentors sharing their perspectives and learning from the mentees in the room. The more junior faculty are both learning how to be a good mentee and how to be a great mentor. Okay, so we didn't make it up. The course curriculum it was adopted from this 2012 W.H. Freeman Mentorship Series, which was originally created for translational and clinician scientists. It was validated, a multi-site randomized controlled trial. And we have adapted our course from this. We've changed the cases to make them more relevant to UCLA and to radiology specifically. And we've also altered it to make it more relevant to non-researchers as well. So those who may have more of a clinical emphasis in their mentorship practices or administrative or leadership roles. So even faculty members with 30 years of experience have reported a significant improvement in mentorship skills participating in this curriculum. And I'm not sure exactly how they measured this, but the claim is that this original curriculum accelerates mentor training, what would normally happen in 10 years' time. So I've now participated in the course 4 times. So I'm basically like an 85-year-old mentor at this point. So how do we get people to show up? So we hold the sessions at a nice conference center in Westwood, the Luskin Conference Center. We have a nice kind of small intimate room. We have food and drink for everyone. So you can eat dinner during the sessions, have a glass of wine or a soda. Our chairman heavily promotes participating in this course at our department faculty meetings. And our participants do receive ARVU credit for participating. They receive 100 points, which means nothing, obviously, you don't know the context. But usually first authorship on a manuscript in this system, depending on the impact factor of the journal, can be somewhere around this amount, anywhere from like 70 to 200 points. So it kind of falls right in the middle of that. So there is that incentive piece too, and this is just a way for the department to show how invested they are in promoting strong mentorship for the faculty. So the course was originally founded by Dr. Aberle, who was our former vice chair of research and our section chief of interventional neuroradiology, former Dr. Vinuela. And I participated in the course during its first year in 2020. And then Dr. Aberle asked me and my colleague and friend, Dr. Luhar, to take over as kind of the facilitators and the directors of the course for the future years. And so under the leadership of our vice chair of research. He kind of gives it a little more gravitas because we originally were much more junior faculty. We get people to show up and participate in this course. And as I'll say in a moment, we bring in senior expert mentors to facilitate the discussions. And this is Arthi and my third year leading the course, which we're amidst right now. So the program goals are to build a community of mentors, create a safe space for group learning, and to optimize mentee growth by learning to have clear and aligned expectations while acknowledging fluidity in the mentor-mentee relationship and enhancing equity through strong mentorship. So now I'm going to take you through a rapid fire version of the 6-week course, just to give you a taste of what it's like when we're hosting this. So we invite a guest expert mentor to lead each session, all of whom have leadership positions in our department. Dr. Moriarty leads an introduction, and then Dr. Ted Hall does promoting professional development and navigating the UCLA system. We then talk about maintaining effective communication and cultivating independence with Dr. Aberly, fostering wellness with Leah Azor, who's our director of well-being, and optimizing the trainee experience and giving feedback with Dr. Sue, and I'll explain a little more about each of these weeks, and then prioritizing inclusive excellence. So for each session, we start with an icebreaker. We have a short didactic from our discussion leader. We do some small group exercise or some sort of handout, and then the bulk of the session is devoted to these provocative mentorship dilemmas, and we have discussions about these cases. So for the introductory session, led by Dr. Moriarty, who's our vice chair of research, there's an icebreaker, and then we ask everyone to think of a mentor who has been the most influential to their life and career. So I've now done this 4 times. I always list the same people. I list Dr. Haramati, who I met during my residency and has helped guide me through every step of my career and is always looking for opportunities for me to excel, like inviting me here to speak to all of you. And then Linda introduced me to Dr. Jonathan Golden at UCLA, who has been my main mentor in research and other career opportunities while at UCLA. And then we talk about, so everyone kind of gets very personal, shares their stories about what mentorship means to them and how it's been successful in their career journey thus far. We talk about ground rules. The space is confidential. Things don't, the ideas are supposed to leave the room, but not the specific stories. And we ask people to really be present and show up in person for every session. Of course, life happens and, there's not 100%, but usually they only miss 1, if any, sessions. We do a handout on effective communication, and here is an example of a case. So I'm wondering if one person would be brave enough to read this case out loud. I don't know anybody's name.
I can read it.
Thank you so much.
I recently started a research project with a second-year resident/postdoc, and I can't seem to effectively communicate with her. I told her at the initiation of the project that we should have monthly meetings to review progress, and she agreed. At our next meeting, I asked her to review what she had accomplished since our last meeting, and she seemed unprepared. She had no notes and very little detail. Since then, she has canceled 2 check-in meetings. At our last meeting, her progress seemed uneven. She is clearly actively working on the project, but I've had to ask her to redo critical components. I worry that these meetings are making it harder for her to accept my guidance, and don't know how to guide her more effectively with this project. What should be done?
So you can see the answer choices here. And then let's see if this works. I'm going to try to ask folks on Zoom to let's see. People are already, it was already open. I think people are already tuning. And I'll share it in a moment. So approach her directly, and then There's one other way if people in the room. Yeah, try to put your phone here. I realize it may not work. See if you can try to vote here. That's working. Awesome. Oh, there'll be more. Those of you all. Okay, so it looks like the majority felt like she should be approached directly about her lack of preparation. Some thought bring in another resident with whom you have worked before to keep her on track. And say nothing because it's her project to complete and she needs to be responsible for the work. This is interesting. We don't always get this majority on, I mean, I think approaching her directly definitely makes sense. We have a lot of discussion about people's experience bringing in other trainees. That's a very common strategy that's cited in our programs and then how to navigate that without making the mentee feel like they're failing. I'm wondering if anybody, I guess, anybody who answered B or C would be interested in sharing their thoughts. Might be somebody on Zoom. Often the answer is somewhere in between, where there's definitely a need to approach directly, but also a lot of experience with bringing in additional people if somebody's struggling and to help a project move forward. I think most of the people in the room might have answered.
Can I ask you a question about
Sure.
that? Sorry, but when people say that, does that mean without discussing it with the initial person who was started the project, or in conjunction with a discussion, would you like me to bring in another person to help you since it's since it's such a big project or whatever?
Yeah, I think it's open to interpretation. I think that discussing it would probably be the most appropriate way to go about it. We often have mentees in the room who would be like, yeah, somebody's done that to me. They've added another trainee to the project. And sometimes I really appreciate the help. I am struggling. But I think that scenario, I think the discussion would be probably a key component of making that choice, for sure. Let's see if I can.
Yeah. Either way, you have to do A, even if you're gonna do B, you have to.
Exactly.
That was the point.
Being direct usually this way. Okay, so now I'm gonna try to get back into my. There we go. Okay, perfect. Okay, this didn't work, so I'm getting past that. Okay. In the second session, Dr. Hall, who chairs the Radiology Promotions Committee, takes us through the promotion process at UCLA. It's quite complicated here, and I think it is at many places, how the different tracks work, what are the things that they're looking for when they're looking for promotions. So he has a number of slides on this. This is just one that I'm sharing, where he kind of goes through the critical pieces for each of the different series and what the promotions committee is looking for. This is one of my favorite cases. Anybody want to read it?
I'll read it.
Thank you.
Dr. Boa is a first-year assistant professor who has struggled to balance clinical responsibilities and research productivity over his first year as an attending. However, he feels that in the last few weeks to months, he has figured out a schedule that works well for him. Last week, his department chair asked Dr. Boa to take an additional project. Though the project is interesting and has great publication potential, Dr. Boa cannot imagine fitting in with his current research and clinical load. Dr. Boa fears he must say no to his chair, but worries about repercussions in terms of his chair's opinion of him. How would you advise Dr. Boa? Support him in saying no, even though it may affect the chair's opinion of him? Strongly suggest to him that he say yes to maintain the chair's positive opinion of him.
Okay.
Do me.
Get the polling. So those on Zoom should see it. And then- Okay, going down, so I'm gonna end the poll. And I'm gonna share the results. And then- Okay, interesting. So, it looks like the vast majority felt that supporting him in saying no, even though it may affect the chair's opinion of him. Now, I've never actually discussed this case when there's a chair in the room. But I'm always in the minority on this case, so I'm just only 6. I'm not gonna put 6 people on a spot, so I will make the other case. I often,
I can make that case.
okay, thank you.
I was one of the 6, the correct 6. So when you're a first year professor starting out, say yes to everything. Get everything going. Some of them will fall by the wayside and you just don't want to say no. It's not so much keeping the chairman on your good side, but you can work it in, but it also will keep the chair on your good side, and you need the chair to mentor you for the rest of your career. Just say yes. Early on, say yes to everything. That's my advice. That could be why I'm such a bad mentor.
I actually, as a mentee, I usually pick the second one too, and I'm always in the minority. Similar reasons. I do think learning to say no and having skills to help your mentees learn to say no is incredibly important for your well-being and for your career growth, right? If you say yes to everything and you can't get anything done, then that doesn't help you professionally either. But that's usually the minority. I also think because it's the chair, you know, as John said, in your brand new faculty, it's a good opportunity to make an impression, which could have an important impact on your career.
But
But
if you overpromise and underdeliver, the chair loses faith in you.
good point.
So I think from my point of view, I am more impressed by someone that says no and has a good reason for it, but is delivering in other areas.
So as long as you're seeing that they're delivering in other
Yeah.
areas, you're less bothered by them
Yeah.
saying no.
Yeah.
Yeah, that makes sense. Any other thoughts on A? Okay, so in our small group, we kind of probe and really kind of draw out, pretty much everyone from the group shares their perspective on these cases. Okay, let's move on. Okay. Okay, so midway through our third session is maintaining effective communication and cultivating independence. So Denny Averly is a decades-long seasoned mentor, and she talks about her pearls for her mentorship relationships. She has, you know, an interesting take because she only takes on a very small number of mentees, and she meets with them every single week. And so she really invests in that mentee's future, and she just can obviously only handle maybe a couple at a time for that reason. She created this mentorship contract that we share with the group during this session. We discuss it, and many of our graduates then use it in their future mentorship relationships. And it's just a snapshot here, but it's a way to kind of set your align expectations and help your mentees meet their goals. All right, and here is a case from that session. Anyone in the back want to read it?
I can read it.
Thank you.
Dr. Atwood and Dr. Benedict have worked together closely for the last 5 years on sarcoma imaging in response to clinical trials. Indeed, Dr. Atwood introduced Dr. Benedict to the research topic when Dr. Benedict was onboarding as a new junior faculty member. Dr. Benedict was recently approached by a colleague in orthopedic oncology to serve as imaging lead on a project applying some of these new imaging methods to benign soft tissue masses. Dr. Benedict approaches Dr. Atwood for advice on the research framework during one of their mentorship meetings. Dr. Atwood is surprised to hear about the project and instead of answering Dr. Benedict's question, asked Dr. Benedict why he didn't invite him to work on the project. What should Dr. Benedict do?
Okay, so include his mentor on the project. Anything discussed during the mentorship sessions means he should be included, or only if there's direct involvement. Okay. Okay, those at home should be seeing it right now.
Shows up at the bottom. It doesn't always.
Okay, looks like that's good. So end the poll. I'll show you guys the results.
Right.
Okay, so the majority feel that Dr. Atwood, who is the mentor, should only be included if she is directly involved in the project. And then about a third were split between the other two. Just go ahead and include Dr. Atwood, and anything they discuss during the mentorship sessions should then, be something there that the mentor is included on that project. I think this comes up more than one might think. You're discussing all sorts of things with your mentor and how that relationship overlaps with research collaborations versus just kind of a separate discussion to get advice and is so would anybody like to just to explain their thinking behind the third? Or the minorities answers as well? It's interesting. It's a little different than what we had in our recent.
I think it's hard because this is like a test question, it's like the third is like authorship, you have to be involved in the project, so
Fair
number
enough.
3 is the answer. But in real life, you can tell that Dr. Atwood may not be the best mentor because he asked
Like, why am I
to be
not on this
included in a
project?
project that he was not actually involved in.
Okay, this comes
So
from
it-
a real case,
tough.
yeah.
When you're a mentee who is a mentor that doesn't know how to be a mentor. So this is kind of that gray zone where you know how your mentor should act. He's not acting that way. So then people might say, okay, you know what, just put him on as author. Like, how is it gonna hurt me?
Yes,
So I think more often than not, that's real life.
so, yeah, absolutely, and I
Because you
think
wanna
a
maintain
lot
that
of these have like,
relationship.
everyone's so used to taking multiple choice questions. There's always like the one choice
Exactly. We
that
know what we're
seems
supposed
like,
to say, but
this
we also
should
know
be the,
we
this
have
should
to-
be the answer. Everyone can hear me, so.
And also, I think this happens a lot with residents too. So a resident might be involved in a project, and I'm sorry, I'm speaking for you guys, but I'm gonna say in general, at least when I remember when I was a resident, that like if I was working on a project and either I was talking to another resident about it and they needed some more authorships or things like that, and they say, oh, hey, can I help you with this project? Or can I be involved in this and that? And so a lot of times you're kind of adding like your friends or other things, people who you know that they need more authorships on a project they really weren't involved in, but then you kind of included them at that because you know that they needed it. And it's not something that, you know, but you would do it because they asked and you're like, it doesn't hurt me. And I can
Yes.
have you get involved, but you're kind of getting involved later on in the fact. So I felt like that happened more to me as a resident with friends asking favors
To be added on to projects.
to be added on to projects. I don't know if residents get that.
I mean, again, I think that it depends on the actual situation. I'm just gonna make like a counterpoint for B. It depends on the degree to which he mentored the author and what he mentored the author on. If he truly mentored the author on the paper
Mhm.
and helped, you know, find direction and resources, and then perhaps he is a mentor on the paper. But if he just kind of told him, you know, here, work hard on this and I'll support you and I'll suggest, you know, what journals it might go into, then that's maybe not enough to be an author. But, you know, there's probably a gray zone.
Definitely. Mhm. Linda?
I think that this case highlights like the very, very importance of communication in the relationship. And sometimes because it's a tricky topic, you know, people hesitate to, you know, go there and have that discussion. But, you know, there is, you know, people who are mentors, sometimes they're research mentors, sometimes they're professional development mentors, and sometimes there's an intermingling of those, you know, which is why what you said, alignment of expectations is very important, but there's also this fluidity aspect to it. So when something like that comes up, you know, it's time to discuss that overtly, I think, you know, bring it into the open rather than to have like a whole bunch of hurt feelings. I expected this, you expected that.
Mhm.
Plus, for a junior faculty, there is a certain expectation to develop your own research programs. And once you have your centers sitting on all your papers, that can be a drag on your independence.
Yeah, that's one of the big themes that gets raised with this case. So Dr. Aberly, her two main points that she brings up in this session, or one of them for this case in particular, she's like, I've never regretted adding someone to a project, adding someone as an author, even if they don't necessarily have the biggest role. Like, I've never been like, oh, I wish I hadn't added that person. But the flip side, you know, you could sometimes feel like you should have added somebody and you didn't. So that's, you know, to point A. However, she's also a huge advocate and thinks this is one of the absolute hardest things about mentorship is cultivating independence in your mentee and not being attached to everything. And I like to speak, you know, for her, she gave me permission and because she has much more years of advice than I do, but she has said that as she's gotten more senior in her career and now she's retired, but back on kind of a per diem basis, it's easy, right? It's super easy for her to cultivate independence because she doesn't care if she's on anything. But it's much, much harder when you're not quite at that level yet and you're still thinking about your own career progression and thinking you can and should be a part of something that you've been maybe peripherally giving advice on. Oh, yeah, go ahead.
I mean, the other part of this is like sometimes the mentor actually has all those commitments of writing those papers, right? They come to him saying, hey, we want you to write this chapter for this book, or we want you to write this paper for this seminar. And they don't want to do that, but they want someone to do it for them or to say, well, maybe this will be better suited for him who's starting his career. And he put me on the paper or not, that's up to him, right? But
What you're kind of expecting.
you're kind of expecting it because those papers comes to you in a sense, and you're like, okay, well, you know, I don't have the time to write it, but maybe I can have someone else
And then usually the mentor would maybe have some input. And
Correct,
then
you
if
will
they
have the
include it,
input, you will
for
read the
sure.
paper, you will do the job, you will help him out. You will probably say, maybe so-and-so can help you out, but at the end of the day, it's your responsibility, because the paper was assigned to you, you're just trying to help someone else out.
Hmm.
So how do you go about that situation? Like, are you expected to be in the paper? Are you not expected to be in the paper?
I mean, I think it needs to be discussed up front, yeah, to win this point, you have to have those difficult conversations up front, for sure. Okay, awesome. Let me. See if I can get back to you. Back. Okay, all right. Okay, so next week we have our session on fostering wellness. We discuss how mentorship imparts well-being to both mentors and mentees. This is led by Leah Azor, who's our director of well-being. She talks about a teacher versus a mentor versus a coach, which is a little more to get into than we have time for, but bottom line is that the mentor maybe shares advice and opinions based on their personal knowledge and wisdom, whereas a coach may be more likely to guide someone to solve their own problems, find the answers, and a teacher imparts their knowledge and skills. She'll talk about recognizing mentee and mentor burnout. And I'm very excited that Dr. Haramati will be joining us in person for this session next week. And here's this case. Anyone open to reading it?
I can read it.
Thanks.
Dr. Pillar has recently joined the faculty at UCLA and receives a development award. At the end of the first year of the award, she has her first child. After returning from maternity leave, Dr. Pillar is more tired and starts missing deadlines required to meeting the timeline of the award she received. The project involves recruiting patients, but she has no time to recruit the patients. Dr. Pillar falls further and further behind, feeling exhausted and unhappy. She feels like a failure. She approaches her mentor, Dr. Sun, and says she never wants to do research again. What should her mentor, Dr. Sun, do?
Okay, so help her disentangle herself from her research commitments, but encourage her to reconsider, work with her to prioritize her commitments. This is one of those, I will say every week we get a very much criticized for the answer choices. But this one's definitely got like a multiple choice and the third one. So this is not an uncommon scenario. I'm wondering if anyone has any thoughts on what they would do in this situation.
Having been in that situation, I would say that it cannot be overemphasized how important support at that time is. And if someone comes, well-meaning comes and says, how can I help you? Or let me help you. Let me give you someone on your side. It's still your project, but there's some busy work that maybe someone else can do to get that person over the hump because it's temporary. It's a temporary problem for them, being a young mother, etc. And they need help to get over that hump, and then it will work again. And I think that that support at that time, in a not grabby style, but actually as a let me help you to continue, is key.
So this desire to never do research again is, you think, more in the context of this acute life event and will pass?
Yes.
Or, yeah, need the opportunity to let it pass, see. Yeah, absolutely. Okay. All right, 2 more, and for the sake of time, I may skip over the polling for one of them. Oh, someone's raising a hand. Can I unmute that person? Let's see.
They might be able to.
Go ahead. Go ahead.
Hi, it's me. Hi, Hannah.
Hi.
Can you guys hear me? I just wanted to kind of echo what Dr. Fu said, having been there myself. But I think that the key here is that it is that whatever the acute phase is, one has to get over the acute phase in kind of a minimally disruptive fashion and get to some kind of new chronic baseline, and then one can reevaluate, because it is true that for some people they will never do research again, or they'll never do biopsies again, or they'll never do whatever it is that is not fitting into their whole picture. But it is certainly the reason that that C was like the most appropriate answer is because it recognizes that this is the acute phase and one has to support through the acute phase until the next phase starts.
Absolutely. Yeah. So I think there has to be room left open that they might make a big life change based on this life event. But helping them manage this acute phase is critical. Thank you. Okay. Okay, so in our 5th session, this is a fun one. So Rob Su is the Vice Chair of Education. He's also been the Residency Program Director for many, many years. And he gives us some feedback on optimizing trainee experience and giving feedback. Here are a few pearls from his session. He recommends that we are descriptive rather than judgmental. For example, you have been late 3 times rather than you are always late. It's purposeful to help the individual consider changing behavior by providing information about how they are affecting others. For example, because you left early on Halloween night, Stan ended up staying 3 hours later and missed taking his son out for his first trick or treat. Guilt. Be respectful of the needs of both the giver and the receiver. For example, it is important to me that you respond within the hour when Dr. Chow requests a consultation, because I have worked for months to encourage her to better utilize our services. And finally, verify that the learner understands and there's clear communication. I want to check that we have both arrived at the same conclusions about how you will remedy the situation. Please reiterate for me the steps you will take. So for this one, we do some case discussions, but we also do little vignettes, because there's just a lot of different permutations. We have some PhDs in the room, usually 1 or 2. So we create a bunch of different vignettes in different types of feedback scenarios, and break out into small groups, and they kind of act them out, discuss how they would handle them. As a breast imager, I liked this one. Dr. Xylophone is working with a 2nd-year resident, Dr. Yo-Yo, on their MSK rotation. I did not think of all these names. They have an ultrasound biopsy of a soft tissue mass scheduled for that afternoon. They review the case, and Dr. Yo-Yo asked to take the lead on the biopsy, to which Dr. Xylophone agrees. But when they are scrubbed into the procedure, Dr. Yo-Yo gives lidocaine, but is unable to visualize the needle tip despite multiple attempts and coaching from Dr. Xylophone. The patient is uncomfortable and appears worried. What should Dr. Xylophone do? So this doesn't have a multiple choice, but they kind of hash it out and discuss. I've gotten some good advice from talking about this case, and, you know, now whenever I'm working with a resident on an ultrasound biopsy, I say, okay, I've never done this with you before, you know, you're newer at this. If you can show me your needle with the lidocaine, you can proceed with the biopsy. If I can't see your needle with the lidocaine, I will gently take over so as not to make it obvious in front of the patient. I learned that through this course, among many other skills. So this one's a lot of small vignettes and discussion. For the sake of time, I'm gonna skip over this one because, well, I'll read it, but I'll mention the themes. We won't do the whole polling. Dr. Earth recently received a grant to fund novel research in breast cancer biomarkers, which allowed him protected time. He has reached out to the section chief of breast imaging, Dr. Farr, to request mentorship and collaboration for the project. Dr. Farr agreed to assist, but has been extremely busy due to a host of other factors, onboarding new faculty, staffing a new imaging center, and 2 unexpected leave of absences in her section. Dr. Earth consistently has to wait 1 to 2 weeks for a response to his emails and has not been able to schedule a meeting in person. His protected time is coming up quickly, and he is worried he does not have an adequate handle on the project to make the most of this finite research time. What should Dr. Earth do? Find another mentor, even if this could offend Dr. Farr, just move forward as best you can, or email follow up, and if it doesn't work, just go to the reading room and just kind of confront the Dr. Farr in person. So this is just, you have a mentor who's just too busy and not responding. And this brings up a lot of themes. One that I don't think will come up in this talk, but it's a really important one, is when a mentor-mentee relationship maybe might not be the right fit. How do you dissolve that relationship, find a new mentor? That can be incredibly awkward because often you've been assigned this mentor, and how do you quit on them, or how do they quit on you? And we have people who share stories about when they've had to find a new mentor and how they've navigated it. And then mentors, when they've had to find their mentee a new mentor because they just don't think the relationship's working. Usually it's about communication and not quote unquote firing the other person, but bringing other people into the fold. And then there's kind of a natural transition that happens. So I think that this person might have more common interests, or might be able to have help with this particular problem. They all meet together sometimes and they kind of navigate that way. And then the last session is about prioritizing inclusive excellence. We talk about the leaky pathway, how you can lose talent as you climb the ladder from, you know, med school to residency to faculty and leadership positions, where folks either just don't choose to go into radiology, or you lose a lot of diversity when you get to higher leadership positions. And so Dr. Kathy Brown talks about how strong mentorship can help retain this top talent in radiology. I'm going to skip over this because I want to make sure I have time for the final slides. But this case is about somebody not thinking they're the right fit with a mentee, but maybe this mentee needs mentorship anyway, and you know, what role you play there. Okay, so those are the 6 sessions. So after our first session, every time we do a course, we have the participants do a mentoring competency assessment before and after the course. So it's the same questionnaire. It's a validated survey on a Likert scale of not at all skilled to highly skilled on 19 different types of mentorship skills. And we saw after our first session that we saw an increase from 3.78 to 6. So across the board, everyone felt that they had improved their mentorship skills. This is a busy slide. It's just showing the most successful areas that they felt they had gained. So these are the 19 mentorship skills that are asked on the questionnaire. The questions that received the greatest improvement included working with mentees to set clear expectations, aligning expectations, and helping mentees develop strategies to meet goals. The 3 questions that had the least, still improved, but the least amount, were active listening, providing constructive feedback, and establishing a relationship based on trust. These are arguably more kind of soft skills inherent to somebody's personality, so maybe a little harder to learn. in a 6-week session. And we also saw no difference between full professors, the different levels in terms of how much they ranked their improvement. So regardless of academic rank, everyone felt they improved. The only question where full professors improved slightly less was working with mentees to set research goals. They improved less than those at a lower academic rank. So folks like the in-person evening aspect with food and drink that sets it apart from the regular workday. In our qualitative surveys, I think the main benefit is learning from others in the group. And one critique we got early on was that some of the case scenarios were too research focused. So we revamped a lot of our questions for the second and third years to have more of a clinical or administrative slant, because not everybody is research focused. The in-person aspect is critical, but very hard for those who live far away and work at satellites. We span 100 miles in the LA area, and some folks just can't make it in. So there's been a lot of requests to offer it over Zoom. And to this point, we have not come up with a Zoom alternative that we feel captures kind of this main benefits of the course. We've stuck to our internal mentorship leaders to come in and lead each session, but we have thought about bringing someone from outside to bring in a different perspective. It's also challenging to keep the course going while maintaining a balanced group, because all of our senior faculty will have finished the course in a few years, and we have a lot more junior faculty coming in. So trying to figure out how to, our leadership is like, just keep doing this course indefinitely, but we're gonna run out of senior mentors to share their perspective. So we've, in terms of next steps, we are preparing to launch a new mentorship match program where graduates from our Teach the Mentor course are then paired with incoming faculty based on their common career interests and goals. We are looking for ways to expand this course outside of UCLA, at society meetings, at other institutions. And we are looking at ways to capture longitudinal data to see if this is really helping the growth of mentees in our department. Final slide, I can't seem to give a talk without mentioning AI these days. Can AI mentor faculty? I don't see why not. They could be part of the village. And then I asked ChatGPT, and AI has the potential to serve as a mentor for faculty members in various ways, much like how AI-driven platforms are already being used in therapy and mental health support by leveraging natural language processing, machine learning, personalized data analytics. AI could provide guidance, resources, and support to faculty in their academic professional development. I was thinking that maybe one day you upload your CV and answer some questions and you get some pretty helpful information that helps part of your kind of mentorship package to help your career growth. And those are my parting thoughts. Thank you guys so much for your time.
Thank you so much, Hannah. It's really a pleasure having you here, and welcome back to Yale. I'm sorry you're going home so quickly, but I am looking forward to joining your course in LA next week. Do people have questions or any other further comments, either in person or from the ether?
How is it that you select people who go into it? So who are the people? Is it being selected by the chair? Is it just like volunteers?
It's a combination. So we kind of each fall, because we do the course in January through March of each year. We kind of sit as a group with our vice chair of research, who helps kind of give us support, and we kind of go through who we think would be good and interested in the course. We send some personal invitations, and then we also send out a mass email after we advertise it at the faculty meeting and see who else might be interested. And then we make a selection based on the balance that I spoke of. So we have, and if somebody doesn't quite fit the balance, because we have too many junior faculty, for example, we just say, you know, we would keep you on the list. We'd love to have you next year, basically.
And it's not by position, so it's not like, in the sense, I think we kind of briefly talked about it, that if you're like a section chief or you have some administrative role, that you have to go through this course.
No, I will say that almost all of our section chiefs have done it. We have our MSK section chief this year. I think we have one or two left to get to, but yes, we definitely always reach out to certain section chiefs each year, and a vice chair if they haven't taken it already. We will make sure all the most high up leadership in the department has participated.
Thank you.
It's really good. We have one more minute. Anybody? Is there anybody on the chats? I'll share 4 questions on the chat.
This is from a while though. What? No, it's from a while. I don't see any new hands up.
Okay,
Okay.
great. Thank you so much.
Thank you, Linda. Thank you, guys.